So walk-ins are just like consultations, just that they are special consultations where the person is not seeing the doctor. So we select walk-in for that consultation. I'll show you an example. So it's a two it's a two-step process. So it's a two-step process. We are going to register every patient that comes to the hospital. That's by law. We need to keep the details so that in case there's a mistake in dispensing medication, there's a mistake in the labs or anything, we can track back to the patient. So anybody who comes to the hospital, whether it's coming to do lab tests, just a walk-in or whatever, the name must be in the system. So if the patient has not been there before, we'll register the patient. So we would still do that at the records and reception or at the nurse's desk. So we'll click on register new patient and register the patient normally with the first name, the last name, the gender, the date of birth, and then the phone number. So that's the key things we'll put there. And then this our folder number. If you want to keep the folder number, we'll put it in here. The system can generate the folder numbers as well. So unless you have special folder numbers you want to put in, then we'll put it here. So basically that's it. So let's say we've registered a patient. So I'll go back to where we were. We've registered a patient. We already have a patient here. So now, because the system requires a consultation before you can make any requests, we'll click on book a consultation, but this time we'll select walk-in request. So let's do that. So we'll select the patient that we just registered, and then in here at the first row we'll select walk-in request. So we are walk-in as part of the consultations. This walk-in request will have no price. It has zero price attached to it. So we'll do that. Then we save. So now the patient is in the system. Now that the patient is in the system, we can go back to the page. I've clicked on the home page icon at the top left corner, and then I'm going to the nurses section. This is where they request the walk-ins. So here, just like we do enter vitals and everything here, I'm going to put another link here straight to the walk-in, but you can still use the enter vitals to do that. So once you click on enter vitals for consultation, it will show you the patients that are there. It's just a link to show you the patients that have come. So this is our patient. If I click on this, you can see I'm supposed to see the place for work for requesting all these services. Sometimes because of the way browsers work, they cache the page. So I just refresh so that I'll see the full page. The page will reload. That's all. So I haven't done anything. I just refreshed the page so that the page will reload. And as you can see, now I have my nurses panel and everything here where I can click on lab tests and then add labs. So I'll click on lab tests, and then this, let's say the patient came to do a walk-in lab. She just wants to check the FBC without seeing the doctor. So we'll select FBC. In this case, we have it as full blood count. Full blood count. I think there should be FBC on the system. Or which other labs do I have here? Oh, okay. I think they have it as complete blood count in this. Okay, so let's say he's doing the complete hemogram. That's how I saved it on this system. So we have this, and then maybe he wants another lab like urine culture. So we'll select the two. And then suppose the patient came for a walk-in procedure like wound dressing. It means that you have to click on procedure side and then come and select wound dressing. If there is, it should be there. So you select the wound dressing. So these are the two things. If the patient came for scan, you would click on X-rays and scans, and then add a row, and then select the scan, maybe pelvic scan. I hope there's pelvic scan here. Okay, so we'll take, yeah, pelvic scan. There's pelvic ultrasound scan here. So we'll select that. So I've actually selected for lab tests, procedures, and x-rays. And then I save. Now, when the patient goes to the cashier, the bill will be at the cashier for them to pay. Thank you.